All right, I want to answer the question I've been getting a lot lately from some of our clients that are using remote therapeutic monitoring is, does the remote therapeutic monitoring codes, the 5 codes that CMS created for physical therapists, does that apply to the Medicare? I'm hearing the word Medicare cap, but what I really think people mean is the Medicare threshold. We all know that the Medicare cap was rescinded or thrown away back in 2018, and now we have this Medicare threshold. And we really have a Medicare threshold, which is saying, okay, are these services that we're providing for the patient, including remote therapeutic monitoring, is it medically necessary? And if it's medically necessary, um, when you reach $2,150, that's the threshold. If you say it's medically necessary, then you can continue to see the patient. So it's not a cap. It's just saying that you need to basically say with a KX modifier and a statement that, it's not a hard limit. It's just saying, yes, these services are needed and they're medically necessary. Now, there's a larger threshold, which is the medical manual review threshold. And that is basically saying that you are increasing your odds of getting reviewed, your chart being audited, if you go over, let's see what that threshold is. I'm just looking here. The threshold for that is, I believe, $3,000. So if we go over the $3,000 mark, we are risking, again, if it's medically necessary, exceeds the therapy threshold, it could be received by a medical reviewer. It doesn't mean it's going to, it just means that it could be. And so, again, if you have a patient who, does need physical therapy, you can continue to see the patient, right? It says on here, CMS retains a third-party contractor to conduct targeted medical reviews. However, not every claim that exceeds $3,000 will receive a review. Some factors that increase the chance of receiving medical reviews include history of lack of compliance, the patient, right? This is what remote monitoring is all about, is trying to increase compliance. A substantial percentage of denied claims, billing practices that diverge from norms of other providers, treatments for certain medical conditions, and limited history as a provider, so new to the profession. Now, I think people are asking me about why RTM, remote therapeutic monitoring, is applying to these thresholds, and again, I think it's because we're worried, I guess, to get audited and reviewed. But I would say that if we are doing remote monitoring and we're doing it right, our whole goal is to increase the compliance of the patient, right? Which improves the effectiveness of this treatment and really proves that you are, trying to help this person, and that if they're being compliant, it proves they are being compliant, which again should be enough to, avoid any problems when you try to prove that you're doing, this for the right reasons. I also think that we have a hard time in the profession with money and finances, and I think that the reality is, I believe as a physical therapist owning my own private practice, that we don't get paid enough. I mean, shoot, I think for every patient visit, it ranges in my clinic from $63 to $100, right? And so that's not a lot. My mechanic makes more than that. My painter makes more than that. And so hopefully you're not asking that question because you're feeling bad about the patient, or you're feeling bad about the insurance company paying you. We're seeing on average $333 more per plan of care, right? So yes, it does apply to the threshold, something to think about, but I believe it's going to improve the outcomes. It should also make your patients need to be in physical therapy less, right? Because they're being more compliant, they're doing their homework. And so I think you'll be less likely to reach those $3,000 medical manual review thresholds, right? And that's a good thing. So hopefully that helps, and I hope you guys have a good day.